Good afternoon, everyone. My name's Ivan Cornford, and welcome to another Zoom session, predominantly for care homes, but any other staff who come across this can watch it. Today I'm joined by Barbara Sayers, who's going to be giving us a presentation on skin tears. Any questions can come through to me if you've got any, and I will pass them on to Barbara. I will also be asking questions as we go along. So welcome, Barbara, and thank you for coming along today.
Thank you, Ivan. Hello, my name is Barbara Sayers, as Ivan has said. I work as a community staff nurse in the Angus District Nursing Service, and I'm also looking at the development and educational needs of nurses within that service. So I'm here to speak to you today about skin tears, something that happens quite commonly particularly in our older population, whether they be walking down the street and have a fall in their own homes or in the care and residential setting as well. So just the aim of this presentation, we shall just move forward. There we go. Is to have an understanding of skin tears and how to care for them. And the objectives are, by the end of the session, you should have some knowledge of the skin and its functions, learn about the classification of skin tears, which we use, find out how to cleanse and care for a tear, and also be able to record, document, and report. So let's just have a look at the structure of the skin first of all. This is your skin. If you look down at your hand, that is the structure of the skin on your hand right now. You can see that there's a very, very thin layer, that's called the epidermis. That's an extremely thin layer. It's got very few blood vessels and it regenerates every 4 to 6 weeks and it gives you protection. I should say that the skin is actually the largest organ in the body and it makes up 10% of an adult's body weight. It has a very protective function for all of us. The next layer after the epidermis is a bit thicker and it's called the dermis, and it supports and transports nutrients to the epidermis. And then we've got the hypodermis, which is just underneath there, and that binds skin to underlying tissues. It stores fat, protects us, and allows movement as well. So just between yourselves at the moment, if you could just have a little think about what the functions of the skin are. I've said a few words already that might jump out at you, but if you have a little think about what the functions of the skin may be.
Sense. I've seen that sometimes. Oh dear. It's really good so far.
Okay, hopefully you've had a rethink just now, and these might be some of the words that you've come up with. First thing is protection, okay, which I've already mentioned. That's what the skin does, it protects us. Then we have sensation, that's how we feel touch. Heat regulation, the skin, we know whether we're hot or cold, and we can look at the skin, sometimes we blush because we're too hot. We've also got excretion, and that's when we sweat. Absorption, the skin can absorb various medications, things like nicotine patches, HRT, fentanyl, which is a pain-killing drug. Those are all absorbed through the skin. And then we've also got storage and synthesis as well.
I didn't understand what that was.
You don't understand what storage and synthesis is?
What's that?
Storage is for water and fats.
Okay.
So that stores within the body. And then the skin synthesizes our vitamin D and vitamin B by the action of the UV light. Okay. So that's to do with the sunlight on certain parts of the skin, and it's linked to your pigmentation. So a darker skin will produce more vitamin B and vice versa.
Oh, okay.
So that's why we need our sun
fine.
cream and protection to protect us, is to do with the synthesis there. So what is an actual wound? Well, a wound is an injury to living tissue breaking its continuity. A wound will either be a contusion, which is a fancy name for a bruise, an abrasion, a fancy name for a graze, a laceration, which is a tear, an incision, a cut, a puncture wound, which is a stab wound, or a burn. An acute wound can be traumatic or surgical, and it moves through the stages of healing in a predictable time frame. A chronic wound does not progress through the stages of healing and does not resolve over an expected period of time. But what is a skin tear? Well, a skin tear is a wound caused by shear, friction, and/or blunt force resulting in separation of skin layers. So a skin tear can be partial thickness, separation of the epidermis from the dermis. So if we just look at the structure of the skin again, If you look at that little tiny bit, the epidermis and the dermis, those two bits would come apart, and that's a partial thickness tear. Or a full thickness, which is separation of both the epidermis and dermis from the underlying structures. So if we look at that again, you can see how much would come off there in a full thickness tear. Who's at risk of skin tears? Well, the people in your care homes, basically, in residential homes, people in their own homes, older people in general. As you get older, the epidermis gets thinner and it takes longer to repair itself. The dermis gets thinner, and the fatty layer of the skin becomes thinner to certain areas such as your face, your neck, your arms, and your lower legs. People with lowered immune system, malnutrition, circulation problems, and poor oxygen intake are also at risk, and premature babies and newborns. So it's really people at the extreme ages that are most at risk, very old or very young. If somebody has a skin tear, this is what we use to classify the type of skin tear that there is. And this is it's very important to classify the type of skin tear, as this will determine the severity and help in planning the appropriate treatment. This STAR skin tear classification system is recommended for use by tissue viability nurses throughout Scotland. So what we need to do is assess and then manage the skin tear to minimise further trauma and preserve the living tissue that there is. So if we look at it, you can see that the category 1A is a skin tear where the edges can be realigned to the normal anatomical position. So that's back to where it should be without undue stretching of the skin. And the skin or the flap colour is not pale, dusky or darkened. And then category 1B is exactly the same, but the skin and the flap colour is pale and it is dusky or darkened. So there's just a difference in the skin colour there. Category 2A is where the edges cannot be realigned to the normal anatomical position and may need some adjustment, and the skin or flap colour is not pale, dusky or darkened. Category 2B again is the same, but the skin or flap colour is pale, dusky or darkened. And then category 3 is a skin tear where the skin flap is completely absent. And that's how you would categorise those and write them down.
And that's a national protocol, is it? That's understood by everybody?
That's understood by everybody. It was devised in Australia, and we've had kind permission from the people who devised it for use in this presentation. And tissue viability nurses throughout Scotland recommend that this is used. So everybody should understand within care settings, hospitals should understand the skin tear classification.
And they're quite distinct. You can see that they're quite distinct.
They are quite distinct, yes. If you look, and you can have a copy of that within, sometimes they advise that you maybe have a little skin tear first aid box, and a copy of that could actually be within that skin tear first aid box in each care home.
Okay.
That you've got some stuff to treat, like your saline swabs, gloves, that kind of thing. And then you could have a picture
is
of
there,
that.
is there a list for a box such as that? Is there a good practice?
There is a good practice that I can get for you,
That's brilliant.
yes, and we can give that. So every care home could have similar
okay.
and have that, and then be talked to as it's being used.
Okay, that'd be brilliant.
Okay, so if somebody does get a skin tear, how do we manage that? That's the most important thing. Well, the first thing is to make sure your hands are clean and use a sterile or aseptic technique. So you'll be putting gloves on before you're doing anything else. Control any bleeding, because it could be bleeding quite a lot. Cleanse the skin using sterile saline or drinkable clean tap water. It doesn't have to be sterile saline. At body temperature, because temperature is very important, and some swabs. You're assessing the degree of loss of skin and or the flap colour using that STAR classification system, which I've just shown you. You should assess the surrounding skin for fragility, swelling, discoloration or bruising. If it's possible, so say it's a category 2A, 2B kind of skin flap, you gently ease the skin flap back into place using a gloved finger, only if it's possible. You shouldn't be forcing at all. Apply a dressing to encourage moist wound healing, such as Nepitel or Aleve. Do not use steady strips. They are now a thing of the past for things like skin tears. And when you put the dressing on, mark the direction of the skin flap so that when the dressing is getting taken off, it's not coming up against the skin flap and just taking all your good work away. So put the dressing on and then mark an arrow as to what the direction of the skin flap actually is. Carry out a pain assessment on the resident, document in their care plan, complete an accident form and any wound forms that you have, and inform next of kin if required. Contact the nursing staff in your home or district nurse to assess at some point.
Yeah, so I suppose in nursing homes, that's what a nurse, that's the nursing sort of work that they would carry out. In care homes, what you're saying really is, at the moment, make sure that you can stop the bleeding, put a dressing on, and then contact the district nurse who will come and assess them what to do next.
Yes, and within that first aid box, that will give you some, so if it's the middle of the night, you don't need to feel that you phone the nurse out in the middle of the night. They could come the next day, and your first aid box could, or your skin tear first aid box could just be a clear box with a copy of the tool, like we said, sterile water pods, swabs, appropriate dressings, and something else.
Because, I mean, the best will in the world, whatever time of the day it is, district nurses don't come out at the drop of a hat.
I'm afraid we don't. And this is just going on to the next slide about when to seek help.
Yeah.
So if the skin tear is very large and looks like a full thickness tear, you should be phoning your GP, a district nurse, or even an ambulance. If there's uncontrolled bleeding or a large hematoma, which is a blood-filled blister, again, GP, district nurse, or an ambulance. If you're treating it and you've managed to contain the skin flap and put a dressing on, if it's failing to progress, then that's the district nurse, but they will have been involved. And if the wound is not healing, then also the district nurse.
I think for most residential homes, the third and fourth point on there, the district nurses will be doing
it anyway, exactly, yes, definitely. Okay. So again, just between yourselves, if you could just have a little chat as to why you think a wound may not heal. So if we just think about the population that we're looking after, why a wound might not heal, what factors would affect that wound healing. So I'll just give you a minute to have a little think. Okay, hopefully you've come up with some suggestions, and again, these might be some things that you've come up with. We look at age. Remember that I said earlier the dermis is thinner, the metabolic process and circulation also slows down. There could be poor nutrition, a lack of protein, hydration results in poor healing. Could be poor general health, things like diabetes, anemia, obesity, heart disease, rheumatoid arthritis, these can all affect wound healing. Certain drugs can affect wound healing, such as chemotherapy, if somebody's taking steroids or anti-inflammatories. Temperature is important. Any drop in temperature can delay healing as well. Could be poor lifestyle, poor mobility, alcohol, smoking, stress. The wound itself could have an infection in it. There could be exudate. Wounds should not be too wet or too dry, or there could be poor practice that the dressing is not actually applied properly. Okay, so how do we prevent skin tears? Because actually that's our first port of call, as to how to prevent them in the first place. The first thing we should be doing is risking any clients, residents upon admission and documents. So assessing the risk as soon as their skin should be checked, assessing any risk in talking to family, getting a history from that family and from the resident themselves.
So someone, if you're looking after someone, it's their first day and they've got lots of the little old 1Bs on their arms and stuff, you can sense
that would be an indication, yes. So you're assessing their skin for fragility, for dryness, for existing wounds, old wounds, and that should all be documented in the records and communicated to all staff. Next thing is look at the room that they're in and the corridors that they're using. Is there adequate lighting? Maybe you should remove rugs and excess furniture. It might be possible to pad sharp corners. Poor eyesight can lead to residents bumping into furniture, falling. So take out anything unnecessary and make sure corridors are kept clear. And then safe client handling techniques. Always use lifting devices or slide sheets. Do not use bed sheets. They can cause friction and shearing. Poor handling of clients often results in skin tears. Please use the equipment and be gentle with all movements. We're not doing anything quickly or sharply. And then reduce or eliminate pressure, shear and friction. So our pressure relieving devices such as cushions and mattresses may be required. And if somebody have poor mobility and unable to position themselves, it could be that they need repositioning every couple of hours as well. Ensure adequate nutrition and hydration. Very important. As we said, poor hydration and nutrition can lead to poor skin. So get advice from a dietitian if there are concerns about that. Keep the skin well moisturised. The best time to apply moisturiser is after somebody's had a shower or a bath, when it can be easily absorbed. Some patients might have, or some residents might have particular moisturisers that have been prescribed for them, but just a general one is important for most residents, just for dry skin. And then what about the clothing somebody's wearing? It could be that to put somebody in long sleeves and long trousers can actually help. If they've got regular skin tears, might even need to consider limb protectors as an option for people as well.
Limb
protectors are just inflatable little things that would go around. So say if they particularly fell on their legs all the time, then that would be something that would need to be assessed, possibly even with the OT, the occupational therapist, and that things can be ordered, or places like Allardyce sell these sorts of things. But hopefully by doing all these other things, we can avoid the need of limb protectors. And then we also have to involve individuals and the families, just inform them of ongoing care, the measures being taken to prevent, and what reporting systems you have in place if skin tears do happen. And then person-centred care plans. Remember that every single person is different and should be treated individually. There should be care plans for each resident, and they should be kept up to date by all staff.
I notice on here, one thing that's missing is around staff with long nails, jewellery, badges, that sort of thing.
Certainly, I don't obviously know your care home policies, but NHS Tayside policy for our dress and uniform is that we are not allowed long nails. We are not allowed to wear any jewellery at all other than one plain band, which doesn't have to be on a wedding finger, but it has to be plain. If you have rings indented with stones, you have the risk of damaging, harming patients by that. So really, you shouldn't have any watches on, any jewellery, and definitely nails should be short. Just keep your fancy nails for your holidays and things like that. It's much better. Will you try it?
I will try to do that.
You'll try and do that.
That will be
what colour are you going to choose?
Well, it was pink last time.
Oh, okay. Maybe go for something different.
Yes.
So just a summary of what we've talked about just now. We're talked about a risk assessment of the patient and making sure that that's documented. We're looking at prevention of skin tears because that's our major tool, is to stop them happening in the first place. We've seen the classification system of skin tears. We've looked at the immediate care of a skin tear. We're looking at reporting for further treatment, when to seek help. We're involving the resident and the family, and we're recording and documenting incidents. So hopefully all of that has helped to meet the aim, which is to have an understanding of skin tears and how to care for them, to meet the objectives, to obtain knowledge of the skin and functions, to learn about classification of skin tears, find out how to cleanse and care for a tear, and also to be able to record, document and report. And that is the end. If you have any questions, as Ivan has said, please do come through him and he can get in touch with myself. There is also a video that has been produced by NES, which is National Education for Scotland, on the effective management of skin tears, and that can be accessed by the link below as well.
A couple of other things. We do have access, and I have them, to some skin tear workbooks. If anybody is interested, you can contact me and I will get the workbooks out to you, and you can have a look, and some of your staff who you think would be useful to do that. I think there is a thing about that nursing homes will manage these in a completely different way to residential care homes, and it's worth remembering that for residential care homes, most of this is just a good first aid until the district nurse comes in and does the wound assessment. In nursing homes, that would obviously be the nurse who does that wound assessment. Any questions about that, just get in touch with me and I'll put you in touch with people. Thank you for watching, and thank you, Barbara, for a wonderful little presentation.
Thank you.
And I shall end it now.